Welcome back to Patient Win Insider. I'm Nick Moen, and today I'm joined by Dr. Omar Yousuf, founder of Texas Dental Specialists in Plano, Texas. Dr. Yousuf's team is redefining the patient experience with same-day full-mouth rehab in a med spa environment that's anything but traditional dentistry. Today, we're going to dive into what it takes to deliver high-tech, high-touch dentistry at scale and the bottlenecks most practices face when trying to do the same. So let's get into it. Thanks for joining me today.
You for having us, or for me.
Right.
But
Well,
yes,
you've got a whole
yeah, the
team,
whole
right?
team that I'm representing.
Yeah,
Yes.
exactly. No, I love that. Well, so let's just start off with cases. Like, what if you could fill your schedule with one type of case? What would that be?
You know, a lot of people would say that they'd like to do just one specific procedure or specific surgery or, anything. For me, anything that I'm being able to comprehensively treat the patient and kind of give them some type of benefit is something that I find a lot of value in. For example, it could be a patient that is just requiring maybe a few restorative treatments plus, some Botox, and that's going to reset a lot of the difficulties that they're having. Or some other, in some other situations, of course, we have patients that have no teeth or completely broken down teeth or dentition in which they require all of their teeth to be removed, implants placed, and then they get new teeth that same day, or even on a more basic, possibly just doing. I think anything in which I feel like we're able to treat the patient comprehensively and attain the goals that they are looking for is something that I feel like that brings a lot of value to what we do and gives us sort of that meaning in treating those patients. So, anything that a patient finds valuable is something that we are looking towards trying to accomplish and get that patient to where they want to get to. If it was a specific procedure, maybe doing a full mouth rehabilitation for sure. It's one of those procedures that I feel like in all of healthcare provides the biggest impact, change, just start to finish. It's impacts so much on a health basis, medically, dentally, of course, digestive changes, mental changes, all of those things get affected within one appointment. It's quite, I don't know if there really is another procedure that impacts a patient on so many different levels in all of healthcare, really, in that quick of a time frame.
Right. Yeah. No, I mean that's incredible. Well, can you walk us through the process a little bit on how you're able to do a same day, full arch procedure?
Yeah, so if we're looking at doing full arch treatment, we call that all on X. It really takes in so much technology, a lot of teamwork, and really investing in the latest and greatest technologies that are available, and then also meshing those strategies and those technologies with surgical training, prosthetic training for not just myself, but for many members of the team so that we can make that whole workflow flow. So for example, the way that we're able to kind of accomplish all of this in one visit is truly taking so much technology and getting all of those records. So there's two-dimensional x-rays, there's three-dimensional x-rays with CT scans, and then taking that data, layering it with intraoral digital scanning of the mouth, and then also facial scanning, which is like a four-dimensional facial scan. Then we're taking those intraoral scans preoperatively, postoperatively, while the patient's in the chair, and then we're layering all of that data together. And then we take something called photogrammetry, which is essentially the cornerstone of all of this technology that makes everything kind of work the way it's supposed to work. So essentially, it is a CAD cam type of camera in which we are capturing the positioning of the implants exactly. An intraoral scanner, many patients have been to a dentist and they get scanned with the intraoral scanner. And that basically took the place of those old goopy impressions and moldings that we used to have to do. And essentially the scanner though is basically just a camera. and it's just taking thousands of pictures or hundreds of pictures at a time, and you go through the entire mouth, and it's like, 1,000 or 1,500 pictures, and those are all meshed together. Now, when we're placing implants and we're going to be printing, 3D printing teeth and all of these types of things, that is not the most accurate way to be able to deliver those teeth to the patient at the end of the treatment. So we take that intraoral scan, and that gives us a basis. But once all of the implants are placed, we're looking at placing or taking that photogrammetry, in which we place these little markers on top of the implants in the mouth. And then we take that camera and we take that scan. And that scan will take and locate all of the implants in one shot. So we take that scan, it's capturing the positioning of all of those implants in one. And then we take that data, send that into the design, and it's now layered with all of these different levels of data. And now we know exactly, extremely accurately, where those implants are placed. We know what the gums look like. We know what everything looks like, how it should be designed, how the teeth should be designed. And then we take that design, send that to the 3D printer. We print out the teeth, and then we're able to deliver those teeth to that patient that same day.
Wow. And so what material are you 3D printing the teeth out of?
So there's multiple different types, and there's a lot of different printers. There's a lot of different resins that you can print with, but what we currently use is a printer. The brand of the printer is Sprint Ray. It's one of the companies that's kind of at the forefront of most of this, I guess you could say. Yeah, and that's also one of the things that we've kind of done is essentially try to stay with those companies that have been at the forefront in this field from the start. So even with implants, we try to stay with those companies that have been around forever. Brands like Straumann and Neodent that are the leaders in full arch dentistry and implant dentistry. Straumann has been the worldwide leader in implants for a very long time, one of the most well-known companies in the world. So we try to stick with those companies that have built their reputation on quality and success and, just overall support and, follow through. And they have long-term studies to prove that they've been around and had long-term success. So Straumann, so from the implant placement or the implant selection to even the printer and the photogrammetry and the scanners, all of those are pieces that make a big difference all along the way. So even our photogrammetry is kind of like the Bentley of photogrammetry. It's really the one that has shown it's the gold standard. I mean, even other companies will state, yes, this company is the gold standard in photogrammetry. So it's kind of along those lines. We want to make sure that we don't take a step back on the quality or the accuracy or the dependability in any of our materials, so that our patients can have hopefully the long-term success that we're wanting them to have. So Sprint Ray is the company that we use, and with Sprint Ray printers, you're kind of locked into using their resins, which are extremely durable. They're very aesthetic, they're very cosmetic, and you can use those. I mean, we use the 3D printer even for a lot of other cases, that are non-full arch cases. So single implants where a patient comes in, maybe they broke a tooth in the front of their mouth, and we're able to extract the tooth, place the implant, and we can even make a surgical guide to guide our implant placement so that that's exactly where we want it to be. Then we're able to print a 3D or get a 3D printed temporary crown that can be screwed into that implant from the day that they walked in with a broken tooth.
Wow.
So it's really cool. You can utilize, I mean, there's so many features that these printers and all of these technologies are there to be able to give us nowadays that it's crazy what we would do without them now.
Yeah. Well, and how long have you had this dream lab, and like where did you find, these tools? How did you know that these tools would kind of change your practice the way they have?
Honestly, I mean, so I've been out of dental school for about 13 years, or over 13 years now. So I graduated from school in 2012. And at that time, uh, I mean, quite frankly, the education in terms of the newest trends in, implants and treatment possibilities and all of these things was, it just wasn't that accessible, quite honestly. And that was partly due to the fact that technology has literally just boomed in the last 10 years within dentistry, and it always has been booming. I mean, we had seen intraoral scans 10 years ago, 15 years ago. I remember I was in school and we saw an intraoral scan or scanner 15 years ago, but that machine required this powder to be put on the teeth and in the mouth. It was just, I mean, so rudimentary compared to what we've got going on right now. So I would really say, I mean, I saw a couple of my colleagues and friends over the last like 8, 9 years just start jumping into a lot of the 3D printing, a lot of the scanning and different softwares and designing different things for their patients. And that kind of really sparked my interest. And then we started utilizing them maybe about 5 years, 4 or 5 years ago, more heavily. I mean, the scanning and much of the scanning has been around in its form, kind of so as it is today, for the last 10 years. But the 3D printing and things like that are now just becoming a part of like almost everyday, practice for sure.
Yeah. And so, how much are you still having to get done off site?
There's still things that we do off-site for sure. A lot of it is due to limitations within the office in terms of just making sure that, for example, in demanding cosmetic cases or things like that, where we want to make sure that we get really high aesthetic cosmetic results, and we still go through a lab that we partner with on the not in-house, and that way we can get really high quality results aesthetically, but also because of that partnership that we've kind of formed with them over the years, it still doesn't really slow us down the turnaround time. But at the same time, there is a reason that there's labs and there's really highly trained ceramists and things like that that are out there that just do work that cannot really be duplicated in-house, unless you have dedicated members that only do those types of things. And we're not at that stage currently, to people who are just dedicated to those roles currently.
But your tech team's outstanding, right? I mean, they've got to be kind of top notch to handle the software and the printers and all the tools.
Yeah, and I would say that our team is pretty great. They definitely can handle almost pretty much any issues that kind of arise. But it's also a testament to how easy it is to use some of these softwares, especially when you go with some of these companies that are just have been around, like Sprint Ray, like some of these scanners. They have overall made it pretty straightforward and almost not plug and play, but they've made it so that there's a lot less hurdles to jump over when dealing with those softwares. So I think it's definitely a little bit of a combination of both. We have a great team that's in place that is doing or dedicated to doing a great job on each and every case, but at the same time, we try to utilize softwares and machinery and equipment that makes our lives a little bit easier too.
Yeah. So, I mean, that's part of the success story, right? What other what other parts of the practice or your experience as the doctor do you see as a success? Like in this year, if you're you have your goals, like what would success look like for you?
I think on a more basic level, I think success for us is just trying to stay as busy as possible, trying to treat as many patients as possible. Of course, we have some metrics that we try to achieve, but at the end of the day, trying to get better and better with each and every case so that we can provide the best care to each patient. And more important than any metric or number or, statistic to me is really knowing that at the end of the day, I mean, I can only hold myself accountable first and primarily, but, this is kind of part of our team culture is that at the end of the day, we look at making sure that we did everything within our capability to be as successful in everything that we did. So that means like, were we as dedicated to providing that top-notch customer service and patient care as we possibly could for each and every single patient that walked into the door. And if not, which we're gonna, everybody's gonna have some ups and downs. How can we improve that? So being able to recognize those deficiencies, being able to grow from those weaknesses and or mistakes or what just ups and downs that we all have on a daily basis, but being able to recognize them and learn from them and grow from them. I think that's at the end of the day, if we can look at that and know that we did our best and that we grew and got better, I think that's a success.
So what is, let's say I walk in the door, what's the patient experience? I know you mentioned it's like a med spa, right? I mean, patient experience is incredible. What does it look like? What walk me through the steps.
Yeah, so for our office, we really strive to create an environment in which our patient, from the moment that they step in to the moment that they leave, they don't feel like they're in like a medical facility or a dental office. The stereotypical dental office has always been super freezing cold. I walk in, it feels very sterile. It feels very, like you've got these big clunky chairs and machinery and, all of that kind of stuff. From the moment that you step in, basically you're greeted, by our team that's at the front. You're given a comfort menu. There's coffee and snacks and different amenities that we have up there. We really honestly want you to feel like you're not at the dentist, but at a spa without being cliched and saying that it's spa dentistry. So, we're not trying to, tell you that you're really at the spa, but we just want you to be at ease as much as possible. And we've taken some of those little knickknacks that we typically associate with a dental office out of the equation. So, things like that sterile feel, things like, the overhead light that's over the patient chair. So we have TVs, headphones, face masks, weighted blankets, the snacks and coffee and all that kind of stuff. We've got, a bunch of different little things that we try, warm towels for your face, different little things that we have that we try to just make it as comfortable as possible and make it so that you're not really like you're not looking forward to coming in, even if it's just for a cleaning or a routine, filling or something very basic. We understand that it might seem like it's something basic to us, but how often do you get a filling in your life? It might be 5, 10 times total, and for some patients, it's their first time or they haven't done it in 30 years. So, of course, we have the nitrous, the laughing gas, we have other sedation possibilities as well. So we can make our patient or make sure that our patients are as comfortable as possible from IV sedation or even intubation if that's what's required, making sure that they're comfortable and safe and just, having them feel like they are kind of being pampered, but at the same time, getting things done that will help them overall with their general health and making sure that they feel as comfortable and as relaxed as possible from start to finish.
Sure. So how are you finding these patients? Like what's working with patient acquisition so they get to have this experience at the dentist?
On this end, I would say that I'm not the most educated person. I think, I've talked to so many colleagues. I've talked to so many different people within other industries as well, even within healthcare. The last year has been a little bit of a challenge in terms of what's working and what's not working. What was working 3, 4 months ago is maybe not working right now, but what is working right now was maybe not working as great 3, 4 months ago. And then every quarter is a little bit different. So having partners on the marketing side and, like your SEO, the people who will be working with your SEO and your website and all your ads and, with Google and Meta and making sure that you partner with people that you feel like you can trust, making sure that you're partnering with people that you feel like are looking to help build your practice from the ground up. I think that's extremely important. And then making sure that those same folks are very willing and eager to adapt, because I think that's the big thing that's happening right now is that the market is just only it's hard to be successful in this market right now without being able to adapt to different things on the fly. Things are just randomly changing from what I can understand. Again, that's not my expertise, but from what I've understood from all the conversations that I've had and even going to a couple conferences, it's really coming down to being able to adjust and adapt to the different changes within the market, within Google, within Meta, and just naturally organic stuff. At the end of the day, I think one of the most important factors in all of this is really making sure that even the team that you have in place within your own office truly values each patient that calls, each patient that comes in, each patient that sends in an online form, because being able to track those statistics, getting those metrics of where, when we get those patients, a lot of times people in business will complain, myself included, that these leads were bad or they were not quality or this or that. You listen to LinkedIn advertisements and they'll say that, how do you get better leads? Everybody's talking about these leads and forms. But if we don't have the proper team in place to begin with that is valuing those leads, those forms that are coming in, then you're almost just wasting your money on those leads and on those forms. So I think it's a top to bottom. This is a time, from what I understand, and I may, I'm again not the expert in this field, but I think this is a time in which you've got to be able to adapt to a lot of different things when it comes to marketing. And you also have to be very flexible in terms of trying out different things that may or may not work, but being able to try and be as, take some risks, take some, obviously calculated risks, but take those chances, see what works, see what doesn't work. What works for somebody may not work, somebody else may not work for you, but then realizing that there are different avenues and different opportunities out there, and then you've got to come up with that cocktail that works for you. So, we've tried our traditional flyers, we've tried normal emails, we've tried going around in, locally, and then we've tried, Google and Meta and, all of the online traditional stuff. We've also gone on the news. So we were on ABC in Dallas here, Dallas Fort Worth. So we did a morning program there. And then also just now starting to figure out how to really bolster our social media exposure or presence and see how that works. But like I said, I think it's extremely important for you to be able to make yourself known out there and make sure that patients can see you, because you can spend, we've spent as medical professionals hundreds of thousands of dollars getting trained, but in today's world, you could spend $1 million and nobody knows who you are because you didn't market yourself. And it's, you could be the best practitioner out there, but somebody's got to be able to find you so that they know that. So
Sure.
we're not competing. Honestly, at the end of the day, it's not a competition between dental offices really, as much as it is a competition between the patient and their other disposable income.
Right.
Although dental health is not a disposable thing, it's extremely important, but that's the way that it's kind of framed, I think.
Yeah. Yeah. Well, that's to wrap it up here. I'm curious, in 2012, what piece of advice would you have given yourself, like, starting the practice in your career?
I think it would have been that. It would have been take those risks, take those chances. I think I delayed taking a lot of those chances, but that was partly due to, when you come out of school, you've got loans, you've got debt, you're scared because they don't teach us anything about business. Not that I'm an expert businessman at all by any means, but they don't teach us an ounce worth of knowledge on business in school, in dental school, in healthcare, in health schools. I mean, we don't get taught anything. My whole family is from a medical background. You just have to figure it out, and that's a lot to figure out when you're trying to. It's two jobs. one as a manager or as as a business owner, and one as a practitioner and provider of healthcare. So my advice to myself back then would be take some risks, get the training. Of course, don't start doing things before you're trained to do them, but realizing that you've got to kind of put yourself out there, go get trained in the field, and really learn the field as much as possible from day one, but also at the same time, business wise, take those risks and chances and come up with what you think is going to work best for you and for your business.
Cool.
Bet on
Amazing.
yourself. That would be my
Say it again.
bet on yourself.
There we go.
Yeah.
I love it.
Yeah.
Well, thanks for sharing all the technology and how you keep the patients comfortable and what's working and the challenges and yeah, I appreciate having you on and having a conversation with you, Dr. Youssef.
No, thank you for having us. And yeah, we really appreciate it. We look forward to trying to really further educate our patients that are out there.
Perfect. All right, thank you.
Thank you.